This is Todd Ponsky. Today we're going to review an article in the Journal of Pediatric Surgery. The title is Flap versus Fascial Closure for Gastroschisis, a Systematic Review and Meta-Analysis. The lead author is Dr. Fuad Youssef and the senior author is Dr. Blair, Robert Blair. So this paper actually was a meta-analysis that looked at 12 articles that did a both mixture of retrospective and prospective case control trials where they assessed the outcomes of the traditional fascial repair, where the fascia was closed with suture, or the newer flap repair, where the umbilical cord is placed over the umbilical defect and a sutureless closure is made with a tape on top. So the umbilical cord is laid on top and tape is laid over that with no suture. And they looked at the primary and secondary outcomes. The primary outcome they listed as mortality. There was no difference between flap and fascial closure. So no difference there. Length of stay in the hospital, no difference there either. When we look at feeding, time to full feeds, the flap patients trended towards having a earlier time to full feeds, but it wasn't statistically significant, so we're gonna say no difference. The difference starts happening now. So the ventilator days were different. The fascial closure patients actually were on the ventilator longer than those that had a flap closure. The surgical site infection, that was also a difference. Interestingly, the fascial closure patients had a higher rate of wound infections than did those with the flap. So fascia had a higher rate of wound infection and the flap closure had a lower rate of wound infection. Then they started to look at umbilical hernia repair. That's the big question. They state that actually early on, of course, the patients that had the flap repair had an umbilical defect more often than those that had a fascial closure. But when they look at how many actually ended up needing an umbilical hernia repair years away, the fascial closure patients actually had a higher rate of needing an umbilical hernia repair than those that had a flap. We hope you enjoyed this review. We hope to review more articles like this, so please send us any suggestions of articles you want to review, and please leave your comments below. Thanks.